Welcome to the ACCC webinar, Enhancing Precision Medicine Through Fully Integrated Genetic Counseling. My name is Stephanie Cohen. I'm a board-certified licensed genetic counselor at the Indiana University Health Department of Medical and Molecular Genetics. I have a dual faculty role in the IU School of Medicine. My clinical and research interests include service delivery models and outcomes related to genetic counseling services. With us today, we have two speakers. Jamie Grund is the Director of the Precision Medicine and Genomic Health at the Breast Centers at St. Elizabeth Healthcare in Edgewood, Kentucky. She is a licensed genetic counselor with over 25 years experience and has led the development and expansion of precision medicine programs across clinical settings, including oncology, pharmacogenomics, cardiovascular, and prenatal genetics. Jamie is a recognized leader in advancing personalized medicine through clinical innovation, cross-specialties collaboration, and strategic program development. Our second speaker is Sarah Peraza-Miller. She is the director of the Cancer Genetics Program, assistant professor, and certified genetic counselor at the Simmons Cancer Center, UT Southwestern Medical Center in Dallas, Fort Worth, Texas. She was the 2025 president of the National Society of Genetic Counselors and has served in a variety of leadership positions at both the state and national levels. She leads a high-volume clinical cancer genetics program that provides risk assessment and long-term care for patients with hereditary cancer risk in diverse patient populations. Her research interests include genetic counseling workforce issues and genomics healthcare outcomes. Okay, so we would like to thank our webinar supporters. This webinar is being produced by ACCC in partnership with From Testing to Targeted Treatments and with the Hematology Oncology Pharmacy Association. And this is made possible by support from Eli Lilly, and Merck. Here's our faculty, and go ahead. We all have nothing to disclose. I'm going to give a short, brief introduction before I turn this over. These are the learning objectives. I'm going to leave them up for a minute just to see. Go ahead. Next slide. So why this matters now? This is a really timely topic because genomic testing is really part of the everyday oncology care. This is no longer a specialty only available in certain areas. We are seeing genetic testing at the hereditary for germline mutations, tumor sequencing for treatment, monitoring of disease, for targeted therapies, and pharmacogenomics. And then long term, we're seeing more and more use of cascade testing so that we can identify and hopefully prevent cancers from happening in the future. Next slide. Testing volume is increasing, the complexity is accelerating, and this is really outpacing our capacity to handle this. But the volume is not really where our major issues are. It's the interpretation of these very complicated genomic tests. As we see the increase in the use of these tests, the broader panels, we're seeing more uncertain variants, more low penetrant variants. And with the use of paired germline somatic testing, it's becoming more complicated to understand the interaction between the two. Next slide. So genomics is directly tied to many different treatment decisions. This may be related to the use of PARP inhibitors or immunotherapy, may be related to surgical decisions. And then looking forward for survivorship, would there be an increased risk for secondary cancers, and how should we manage that? Next slide. So one of the big barriers to integrating genomic care into the oncology setting is the genomic literacy. There's the risk of misinterpreting an uncertain variant or as an actionable finding, maybe missing out on the opportunity to identify people with a hereditary risk, failing to trigger that cascade testing that allows us to identify people at risk before they get cancer, and then inconsistent and difficult electronic health records with the dreaded PDFs that get uploaded. Next slide. There are gaps in our workforce and common breakdown points in the genomic healthcare delivery. So we're seeing a lot of tests being ordered, but not necessarily interpreted or used at all. They're being filed away. There's no ownership of the follow-up, and there's poor integration with the electronic health record. Next slide. So to address some of the gaps in genomic care, recently the National Society of Genetic Counselors partnered with the ACCC and Facing Our Risk of Cancer Empowered to identify what gaps existed and develop a toolkit to assist with incorporating genomics into the oncology care. Next slide. One of the challenges that was learned from this project in incorporating genetics into the oncology team is a lack of awareness of the value and clinical role of genetic counselors. And then navigating the financial, logistical, operational culture to include genetic counselors. Facilitators were that in some cases we found that the value of genetic counselors was recognized in terms of outcomes for patient satisfaction, for quality, equitable access, that we have demonstrated financial impact in a positive way with the downstream revenue, patient retention, and then the variety of different staffing models. We are now seeing many different service delivery models of incorporating genetic counselors and genetic counseling services. And this engagement with many stakeholders will certainly be a facilitator to incorporating genetics and genetic counselors into oncology. Next slide. I'll direct you to this toolkit that was developed as a result of this year-long project. You can find it on the National Society of Genetic Counselors website. And this includes many different resources, sample dashboards, job descriptions, and so on that will help advocate including genetic counselors on the team in your oncology setting. And now I'm going to turn it over to Jamie Grund, and she will take it from here. You want to move to the next slide, please?
Hey, great. Thank you. Like she said, I'm Jamie. I am a licensed genetic counselor at St. Elizabeth. I'm in Northern Kentucky, and really learning to talk about why this matters and why it's important to work towards getting genetic counselors central in the genomic care within oncology. I spent the last several years beating this drum to make this come to fruition at our center and wanting to share that experience. And I think that it's really important to recognize that genetic counselors, as we grow our programs and get embedded into clinics, that we're not support staff, we're not the afterthought, but to really work as clinical decision partners and embed into care pathways and not the afterthought or the downstream, because we're working to distinguish the significance in findings in the germline space and sometimes in the somatic space as well, helping to interpret those complex and uncertain genomics results, and to take those genetic results and put them into the context of care, the care goals for the patient, and then facilitating that appropriate follow-up testing, cascade strategies, all of the downstream things. And so knowing that genetic counselors can be the caregivers to bridge that gap between genetics and action. Next step, next slide. And so again, that no other role within medical oncology that you see will really combine all of the things that can, again, bridge that gap, with variant interpretation, being that clinical expert that can look at those nuanced classification of complex and uncertain results, really taking those results and being able to personalize them to the individual, knowing that you may see different penetrance or risk based on some of these complex variants, and being able to personalize that to the individual given their clinical history. And then coordinating testing across generations, being that owner of the cascade and family testing. And then again, I think genetic counselors have that unique skill set of translating ambiguity into action for patients and being able to really incorporate genomics into their care. Next slide. And we talked a little bit about cascade testing and how it could be potentially, a really big missed opportunity within oncology. And I think we've all had that patient that shows up perhaps already affected with a cancer. And when we're looking back, we're seeing that, lo and behold, there was a mutation somewhere generations up in their family, and they just weren't aware of it. It hadn't been shared, and it, was rediscovered again in another generation. So we know that there's a low uptake of cascade testing, um, even though there's a clear reason to offer it to family members. And oftentimes it relies 100% on the patient to relay that information to their family members. And if there's a breakdown in that communication, can again continue across generations without being recognized. And most systems lack a standardized protocol for cascade testing. And that's an opportunity for genetic counselors to become the owners of those workflows. Again, because for the system, that is a high yield of individuals who have a risk of developing a cancer in their lifetime, and it really aligns with most health systems' goals of preventative care and earlier recognition of disease. And so those genetic counselor workflows could really uptake that. And then linking to, we said, like the downstream revenue and quality metrics that hospital systems follow. So getting the genetic counselors embedded not only in the workflows for the affected patient, but then downstream for their family members as well. Next slide. And so the solution, how are some systems embedding genetic counselors by using this toolkit? What are some of the models that they're following? And so some systems, sort of a starting point, your traditional genetic counseling model that is referral based. So that is dependent on a clinician recognizing those red flags for a family member or an individual affected with cancer, and getting them to a traditional genetic counseling model. And a very good starting point, and something that we've all seen grow and develop over time. And then working on embedding into more in the clinical side, and a growing adoption of genetic counselors within medical oncology. And that's really working together with our medical oncology clinics to recognize that connection with genetics, bring them in real-time decision support, and improve the access to care. An example of this model could be, for example, in our breast centers, we've worked together with our genetic counseling schedules and our surgeon schedules, putting them side by side and making sure that every patient with a new diagnosis that's meeting with a surgeon, their next step is with genetics. And so it's taking away that need to recognize those red flags and to put that dependent on remembering to have genetics as part of it and really incorporating it as part of their team. And then future state, or next level, is really a precision medicine, a programmatic model, where you have that centralized genetic counseling team embedded in workflows and embedded in systematic protocols. Again, not relying on individual providers, but just becoming a standard of care, really. And so again, recognizing genetic counselors as a core member of that team. And once that happens, we have active participation in the tumor boards to recognize those individuals who would benefit from testing, to own those cascade testing workflows and embedded in the treatment plans, and developing those partnerships with pharmacy, oncology, and the rest of the care team for the patient. And so the goal is, with that fully embedded integration, you're going to have more accurate interpretations. So the results are not only going to be there, but going to be used and actionable for the patient in the right way. Increased appropriate testing, panels versus single gene versus all the different nuances within testing to make sure that it's being offered appropriately, improving the cascade testing uptake and better treatment alignment, and enhanced patient experience. And I think at the end of the day, every medical oncology team that works together closely and collaborates with the genetic counseling team will say it all is better for the patient. Next slide. And so I just have an example of a slide that I shared with our medical oncology team when we launched our comprehensive precision oncology program. And so this was a real effort to take the siloed efforts that were going on around molecular testing within oncology and bringing them together in one place with one oversight to better incorporate and support the medical oncologist. And really the goals of that program would be increased access, ensuring the oncology patients have access to well-vetted molecular testing options. So again, making sure as new vendors and products come on the market that they bring benefit to our patient population, and have had a genetic expert look at those, the studies that go with those. Again, obviously being the genetic content experts really makes sense to have genetic counselors playing that role within our medical oncology groups. Administrative support, we know that a lot goes on behind the scenes to make sure all of these things flow properly. an active molecular tumor board to take the somatic results and put them into action, but also recognizing those perhaps unrecognized germline findings. Pharmacogenetics is a piece of that comprehensive program, and then support to our providers. And so really the goal of bringing everything together and really embedding genetic counselors as part of the team is to provide that up-to-date recommendations and guidelines regarding the use of all molecular testing within oncology, and really meant to supplement and assist providers as they undergo that process. So you'll see the little teal arrows. Those are places within our program that we have genetic counselors active and engaged in those areas. Next slide. My team would love this. Here's their pictures for everybody to see. This was the slide to show and recognize that it's not just one individual, but a full team. This is just our example of our medical director, who is an oncologist. We have an oncology pharmacist in play, excuse me, a nurse practitioner, and a navigator for all the behind the scene works. But you'll see central to this, the core program, is our coordinator of clinical genetics, who is a licensed genetic counselor working with a team of about 4 other genetic counselors. And next slide. The components of what a comprehensive precision oncology program may look like. These are the components of our program. We obviously are led by an advisory committee because you don't want to do this in a silo. So working together with the genetics team and the oncology team to be working hand in hand for the big decisions that are being made as far as test selection, and protocols to follow to make sure that that everybody's on board with the same program. Obviously, hereditary cancer program, incidental germline findings program. We have our genetic counselors embedded in that as well. Molecular tumor board, we talked about having genetic counselors as well as part of that team to find germline recommendations. We do have a cancer prevention clinic, so that's the home for individuals that have been identified as high risk based on their genetics or family history, having an oncologist and a nurse practitioner who follow them long-term for their surveillance and recommendations. But we do have obviously a genetic counselor that works closely with those providers to make sure the recommendations are up to date, the cascade testing is up to date, and that clinic is supported by genetic counselors. Multi-cancer early detection as it's coming on the scene. In our team, we have our genetic counselors being at the forefront of that testing to make sure that we're offering that in a responsible manner as it's coming on in care. And molecular navigation, again, helping the process through. So these are just, again, another example of how genetic counselors can be fully embedded within a precision oncology program, with those teal arrows being the different places where our genetic counselors have been embedded. Next slide. And so lastly, sort of next steps. And this is something that I'm sharing. This is the vision of our multidisciplinary care teams, showing that moving towards, like a GI specific multi-D team and a breast multi-D team. And really knowing that optimal cancer care is achieved when specialists don't work in isolation, but together, surrounding each patient with a network of clinical, emotional, practical support throughout the continuum of their care. And the reason I share this is you'll see patients at the center, teams collaborating without barriers, that the care is coordinated and services are innovative and compassionate. But you'll see that it was a huge win and a huge mindset change and a culture change to have genetic counselors and genetic testing as part of the core multidisciplinary team. And so I think that, again, that's the goal of working through this process of embedding those genetic counselors, is to understand genetics as an expected part of oncology care, and genetic counselors are the best team members to bring that to fruition. Next slide.
Good afternoon. I'm Sarah Pierzadeh-Miller, and so glad to join this fantastic team to speak a little bit about a couple of examples that'll dovetail nicely with what Jamie just spoke about in regards to our practice at my institution. And one of them actually goes right along with the piece that she was talking about regarding thinking about multidisciplinary care, where genetic counselors are very much a central piece and part of that, which is our genetic cancer prevention clinic. Next slide. So when speaking to our institution about really thinking about making this live entity several years ago, the background of our practice is that we are a academic and community-based practice, high volume, see over 7,500 patients a year last year. And so we're identifying thousands of clinically actionable mutation carriers. And like Jamie spoke about, just the need and the growth of this is just going to be never ending. And so how do you deliver this care in a sustainable and scalable way for patients that now have these 2 or more cancer risks that they're now dealing with management for a lifetime? And we had a lot of providers that also had a lot of concerns about, hey, am I able to handle all of the care that these patients need in a way that really meets them where they are and really maximizes their healthcare outcomes? And so these were pieces of the conversation that we had with our leadership to really talk about why this clinic was needed. So certainly making in our area, making us a destination for pre-Viver care, because that's really the focus of our clinic. And so bringing in those individuals who might be getting care from the community to ensure that they're getting care for our internal and our external community members. Certainly, I'm thinking about cascade testing, like Jamie spoke so nicely about, and Stephanie did as well. And certainly we also think about that fiscal piece, which I'll speak a little bit about in a few minutes, regarding direct and indirect revenue that this can bring to the institution. And that fiscal impact is an important part of the conversation. And certainly, as I mentioned, we had many healthcare practitioner partners who have lots of our clinically actionable mutation positive individuals in their practices, making sure that they're getting that care over time in a way that's really robust. Next slide. So that is how the vision for how our clinic was formed about 3.5 years ago. And essentially, as I mentioned, a multidisciplinary practice. So with the genetic counselor, the healthcare practitioner of record, which in our clinic is either an MD or an APP, advanced practice provider, as well as a genetic nurse navigator, which Jamie spoke a little bit to in her practice. And that's truly, as I tell so many audiences, is the secret sauce of this clinic, really being that glue from before the visit with us, a touch point during the visit with us, and afterward, when patients have questions and things that they need to navigate in between those annual visits that they typically have with our clinic. This clinic is truly a pre-Viver focused clinic. So we aren't bringing in active cancer diagnoses, because certainly they're on a journey that they already need to be on. But after they are out of active treatment, we're ensuring that they're plugged into this clinic for almost, a survivorship type of care, type of a construct. Certainly, we're keeping that cascade testing conversation going with these patients over time. And we know that those questions and needs change, over the lifetime. And we're able to really navigate those conversations, certainly with evolving management updates, updated testing folks might need. We actually have about a 20% positive rate on individuals who do updated genetic testing in our practice in this clinic. So we're finding multiple actionable mutations, and certainly the follow-up that needs to go along with that. And we operate in a hub and spoke model, which is essentially someone with a cancer risk associated gene mutation comes into kind of our hub in terms of genetics care. And then there's some pieces of that management we may provide, but then the spokes are getting some of that management that might be better served in a disease-oriented team out to those clinics. So the high-risk breast clinic, the GYN oncology prevention clinic, and such. So we're really able to utilize all the amazing resources at our institution, but we've got that hub of genetics care with us. Next slide. So this is just a little illustration of what that flow looks like in our clinic, with the genetic counselor, the healthcare practitioner of record, and the genetic nurse navigator, and the roles that we fill. And I think the really the beautiful thing about that, the genetic counselors in our clinic love the fact that we really get to focus on our genetic counselor competencies. And so as we think about genetic counselors, practicing at top of scope, this is the place where it's done. So really ensuring that the genetics focused questions and updates are really addressed in every visit with a patient, that family history is updated, that those cascade testing conversations continue to happen. Before we had this clinic, we didn't have those touch points over time. And we knew that our patients, those questions evolve so much, right, over the lifespan, that it was impossible to do our patients the way they, in the right way over time that really maximize their opportunity, not only to maximize their healthcare outcomes and compliance to medical management recommendations, but also helping their families understand their risk as well. Next slide. So we'll get to some of that fiscal impact piece here on the next couple of slides. So we'll go to the next slide here. And in our team, a few years ago, we started our series of a couple of pieces of literature that really dove into looking at not necessarily in the GCPC construct that I just spoke about, but more in the genetic counselor risk assessment lane of things, where the genetic counselor is seeing a patient, identifying a positive a patient, excuse me, with cancer risk associated mutation. And in this particular paper, we focused over a 10-year period on those where we identified a BRCA1 or 2 or a Lynch syndrome related gene mutation, because that's focusing on those tier 1 conditions. And what we essentially found was very positive return on investment, to say the least. You know, when we think about the downstream impact to our institution that was seen once we identified these individuals with multiple cancer risks and all the services that they got after that related to that care. And in our particular paper, our institution looks at that fiscal impact as the entirety of that fiscal impact. So those appointments that may not be related to their particular gene mutation recommended management, but any other care that they might need as well, that because they kept their care in our institution, that was happening in our institution, and that was wonderful. And I think really the really important take-home point here too is thinking about the patients as we slice and dice this data, where patients that were unaffected with cancer, naive to our institution, and that those numbers, looking at those downstream revenue numbers, because that's where the genetic counselor, essentially our service brought the patient to the institution, and then they kept their care going forward. And so you can see there that that with the naive patients of almost $6 million over a 10-year period, again, to say the least, is very positive return on investment for genetic counselor services for the institution. And if we go to the next slide, we'll see an expansion of this work where we looked at the entirety of, our team did a lot of next generation sequencing panels from the time that they were released in about 2014 or so. We were high adopters of those from the beginning. And so we really looked at to take the methodology that we used in the first paper, and then we expanded that to look at the other genes and that same impact down the line with the institution from the genetic counselor identifying those gene mutations. And again, slicing and dicing the data very similarly, you can see that very positive return on investment. And in particular with the unaffected naive individuals that we kept in the institution after our services, which I've been very glad to hear around the country that this has been helpful data to have, to talk to administrators and leadership about, just some of these fiscal pieces that certainly are very important for business. Next slide. So one important point in these two papers was that we did not integrate genetic counselor billing for service with our professional billing code because we were not billing for the entirety of those study periods. So in the future, we definitely have plans to bring that in because we have been billing for genetic counseling specific services with the CPT code now 96041. Since 2020. So we will have the ability to look at that going forward. But as we think about instituting genetic counselor billing for service, looking at the impact of all of these pieces to the institution, my big message is that all of this is so important as we think about genetics and genomic services over time, where genetic counselors are truly involved in those services happening, and really growing over time, like Jamie talked about in her practice. So certainly while revenues don't offset for many all the costs, all of these pieces are so important to make sure that, again, we're not leaving things on the table. Next slide. So to wrap us up here, certainly we have a lot of key takeaways from all the information that we've presented here today. Certainly, it's no surprise that genomic testing is expanding rapidly and certainly is in all elements of oncology practice and beyond, certainly, as we think about just medicine and healthcare practice. And the critical piece of interpretation and application of precision medicine, that piece is what really has to be addressed in a really robust and sustainable way as we think about how practices are moving and shaping what this looks like for patient outcomes as well going forward. And as we think about those workflow gaps, that creates real risk. That's a real liability. As we think about how are we getting this care to patients in a way that actually is not being misinterpreted, is not being taken out of context of their health history, those types of pieces are really critical. And as we think about all of this, the big message is fully integrated CGC models are critical for the precision oncology infrastructure. And as these programs are growing around the country and in many different types of practices, making sure that genetic counselors are a very firm central part of that work with the healthcare team to make sure that this is all being done in the way that makes the most sense for patient care. Next slide. And this is a thank you from all of us. We again, thanks to our partners at ACCC for this invitation to talk about this really important topic to all of us, and really giving this a platform here with all of you. And our emails are right here in case anyone has questions. We're very, very happy to have ongoing conversations and such with anyone who might want to. So thank you so much.